All right. My fabulous marketing team, I show that it is the top of the hour, so I think we should go ahead and get started because I definitely want to utilize this entire session to hear from Anna Patrick on the benefits of Medicare Center. So thank you everyone for joining us today, whether it's good morning to you or good afternoon. I know we have agents popping on from across the country, so thank you for taking time out of your schedule to be with us and to hear from one of our valued partners. Anna Patrick is with Medicare Center, and you will hear so much more about all of that. My name is Marisa Kanold. I am just one of the sales directors here with Fidelis. I am backed by an entire team who I will briefly introduce you to on the next slide. But Fidelis, we host these national webinars monthly. And so we're always bringing you industry-related topics, valued content. We have our featured speakers, and I get so excited because I call her my sister from another mister. Sometimes people think that we're related, but I get to introduce Anna Patrick today on our Medicare Center training. And we're so grateful to have her here. So I know she's going to be talking to us all about the features of Medicare Center. And if you don't know what Medicare Center is, first of all, where have you been? But if you don't know, it is such an incredible, rich, and robust resource. It's a CRM, it's an enrollment platform, but it is so, so much more. And just by being a Fidelis partner under the Integrity umbrella, you get access to this for free. So it's incredible. We could do a deep dive down every facet that this platform can bring you, but we will challenge you to please use the Learning Center in Medicare Center because you can have self-paced courses going throughout those opportunities there. You can kind of become your own expert. But today we're going to hear from Anna just to talk to us about how to make the most of this and make this work for you going into another AEP, because here we are. It's crazy, but we're already in June. So before I stop talking and turn it over to her, like I said, I am just one of several sales directors. So this is our sales team at Fidelis. And spoiler alert, you might soon see more faces added to this map, this coverage map photo, because Fidelis is growing, our agent base is growing, we're just growing, and we're constantly expanding more ways to support our agents. So as you can see, whether you reside in another state that's not that doesn't have a local office in your area, or you just write business in other states, we have you covered. So you can see our sales team there. We've got Carrie DeVore. She's kind of our queen of the West and then some Midwest states. Brad is in New Mexico, but he's moving to Tennessee because we've got an office out in Tennessee now. So you can always count on Brad for kind of that region. Plus, he's still a master of the Southern states. There's me, Marisa. I'm based here in Colorado, but I've got that northern area. And then we've got Nick, our king out east, and he is covering all of the East territories. Florida continues to grow. Texas continues to grow. So please contact each of your respective sales directors just to talk more about how we can bring support to you, grow your business, talk business planning strategies, talk resources. But again, the resource that we want to highlight this morning and this afternoon is Medicare Center. So with that, I'm going to turn it over to Anna.
All right. Well, thank you so much for having me here today. It's always an honor being able to be with you and your agents. I know I've been at several of your agent events in the past. So I love connecting with your team. You guys honestly do an incredible job at servicing your agents, but you're just good people. I like you guys. We always have great integrity partners, but you guys are ones that I like a lot. Just good people there. So you guys are all in good hands with any of those sales directors. So my name is Anna Patrick, and I'm the Vice President of Sales Enablement and Tech Adoption at Integrity. Really focused in on our health side of the business, but I also do a lot on the life as well. But what I am really passionate about is showing agents how they can utilize their technology to better drive sales. So that's part of my title, sales enablement and tech adoption. So I love putting those pieces together for all of our agents, because what we are building at Integrity in our technology space is helping you better manage and serve your clients. That allows you to grow your business and increase your sales. So we want to make sure that anything that we are developing, that we are putting our agents front and center and making sure that we're providing you tools and resources to better serve your clients. Whether you meet your clients in person, over the phone, or online, we want to provide you those tools and those resources to do that, especially during AEP, when it is the busiest time of year. We are constantly thinking, how can we streamline processes for agents? How can we make it easier for you to communicate with your clients, to obtain information, to see your clients that you need to reach out, be proactive and reach out to? So a lot of the features that I'm going to cover here today is to really get your wheels turning on how you're going to be able to utilize this technology for AEP. But I'm also going to let you know of some enhancements that we're making to the platform as well. I don't have necessarily demos of those enhancements, but I will definitely talk through them with you. That way you know that they are on the radar, because these features will be extremely helpful for you during AEP. So let's just first navigation wise, I know if you are newer to the platform, just make sure that you have registered for an account. All you need to do is go to integrity.com and you'll be able to log in that upper right hand corner. And then once you click that login, if you don't have an account set up, you can register with your NPN. The web version of MedicareCENTER, Integrity's tech platform, is incredible, but just keep in mind, there is also a mobile app. So if you have not downloaded the Integrity for Agents mobile app, go to your Apple Store, your Google Play Store, search Integrity for Agents. I love the mobile app, and I love it for agents because I understand how many of you are on the go and you are busy, especially during AEP. Some of you have clients coming into your office. Some of you are on the road driving to clients' houses. Some of you are doing virtual appointments. So having that mobile app is so helpful, because anything that you can do on the web version, except our marketing section, is available on the mobile app. So if you need to quote on the go, send a scope, do an application right there from your phone, log an activity, log a note, initiate a call recording, that can all be done in the platform. Now, when I talk to agents about MedicareCENTER, what I always like pointing out is that this is a tool that you can service your clients during AEP start to finish. So from creating a contact to getting a signed scope of appointment, maybe it's a call recording, storing their health information in the system, going through a quote, sending a comparison, going through an enrollment, following up with your client post AEP. All of that can be done on one platform, which is why it should be your go-to during AEP, servicing those clients start to finish. So a couple of things I want to highlight is I have signed into the particular platform. You have your dashboard, your contacts, your marketing, even an option to do quick quoting on here. So for those of you that have utilized the platform in the past, we always encourage you to create a contact first and foremost, by adding that contact and then going and running a quote. But we know there are some cases where you just may want to review available plans in an area and maybe not have a particular contact or client in mind. Maybe you just want to review some carrier options, plan details, etc. You can now come in and run a quick quote inside MedicareCENTER, and it just prompts you to enter in a zip code. And then once you enter in that zip code, you can go right into a quote without needing to create a contact. Now, the big thing with Medicare Advantage quoting is you're going to want to store your contacts because you're going to want to be able to store those providers, prescriptions, pharmacies, making it easy for you throughout the year. But again, if you just need a quick overview of plans available, that is one option that I know agents have been asking for a while. So that's an update that we've made. But where I really want to direct you to in the platform is in your in the upper right hand corner of your kind of where your photos at, your NPN is over there too, as you hover over your initials or your photo, is if you go into our account section. Now I want to make sure that all of you are aware of some of those additional features that we have available to you, like providing you your own plan enroll agent website, your call recording functionalities, because there's some key features that are going to really help you be successful during AEP. So if I navigate over to my account, we have your agent profile. Now, we recently updated the agent profile just to make it more accessible for all of you to update maybe the products that are shown on your Plan and Enroll website, because we are continuously adding products to the platform. But also for you to add a bio about yourself. Those bios were paused for a long time as we worked directly with compliance on some changes to that. So if you've not gone into your agent profile recently, please review your product preferences. As we add products to the platform, you'll be able to turn those products on and off on your Plan and Enroll website. That way, like let's say for life, if you only do final expense, you can turn off the IUL or the Index Universal Life. On the health side, you are now seeing Medicare Supplement in there. So we're very excited to be launching Medicare Supplement quoting here within MedicareCENTER's platform. A lot of you are currently going to that CSG app to run your MedSup quotes. So sometime this summer, I don't have the exact date yet, but this summer before AEP, Medicare Supplement quoting will also be in the platform for you. So when you go and you run a MedicareCENTER quote, it's going to ask you, do you want to do Medicare Advantage? Do you want to do prescription drug? Or do you want to do Medicare supplements? So that's why you'll now start seeing Medicare supplements in those product preferences, getting ready for that launch. And you can customize it with your photo, languages spoken, agency name, office location, office hours, years of experience, and then add a short bio about yourself. Now we do have this disclaimer here just saying that whatever you put in your bio section has not been approved by Integrity or Plan Enroll. So that is the disclaimer that we have, but we do have some submission guidelines that we do encourage you to follow. These submission guidelines is directly from our compliance department at Integrity, making sure that whatever you are putting out there, you are saying it compliantly. So if you want some guidelines on that, that's what I encourage. And then down below, you do have your Plan Enroll agent website. This is your agent website link. Every agent has their own Plan Enroll site that is personalized to them. So when I navigate to this agent's Plan Enroll website, you have your photo, your name, your NPN, your agency name, your location. If I click on Learn More, this is where I will see that bio, those product types, and then languages spoken. Now, your Plan and Enroll website is such a great tool for you to take advantage of this AEP. And there's tons of great reasons for that. So there's three main features of Plan and Enroll. Now, remember, Plan and Enroll is the direct to consumer facing website that you will use. So if you have clients that are interested in self-quoting for Medicare, they want to review their plan options, they can do that through your Plan Enroll website. They will only be able to see the companies that you are contracted with. And currently today, we do not show any non-commissionable plans on that direct-to-consumer website. So keep that in mind on here. And then the other great feature of Plan Enroll is that they can self-enroll. If they do self-enroll in that Medicare plan, you would get credit for that sale. You're the agent of record. You'll end up seeing it as one of those plans on those carrier websites where maybe you're tracking your business. So you will still be notified as well. You'll receive an email notification letting you know that Jane Smith enrolled in an Aetna Medicare Advantage plan. So you'll get those particular notifications if your client does that. But it's just a way of being able to service clients, especially if you're servicing clients remotely, virtually, or you have clients that are comfortable self-quoting and enrolling. We also have this incredible learning center. And I tell agents all the time to take advantage of this learning center. Not only is it great for really working with a brand new client or prospecting clients, but it's also a way for you to stay front and center with your clients. So if you're an agent that's very active on social media, maybe you are connected with your clients on social media, being able to share content that is going to remind them of that you are their agent. Oh, I didn't know that. I know you're my Medicare agent, but I also didn't know that you do final expense, or I may be interested in final expense. We have really great articles, videos, infographics, and guides that you are able to share out with your clients. I know a lot of agents that may send out newsletters to their clients. These are all articles that you could include in that. But it's a great way for you to filter by coverage type as well as by topic, because the more our clients view us as a trusted source, somebody that they could go to help answer their questions, the better your retention is going to be with that client, but also the better your referral rate is going to be as well. So feel free to utilize this content. I tell agents this is a great way of getting engaged with your clients. You know, even topics on AEPs coming up, or OEP, or special enrollment periods. Lots of great stuff to really stay connected with your clients, and you can utilize this. For those of you that are doing like Medicare 101 presentations, there's videos that you could play during that presentation. That way you don't have to reinvent the wheel. And then the one thing that is probably the key feature of Plan Enroll, and where agents have been so successful with it, is what we call Get Synced. And your Get Synced button is at the very top of the screen here. And what Get Synced allows your clients to do is either update or provide their health information with you, as well as complete a scope of appointment. So this is something that you should absolutely take advantage of. You can send an email to all of your clients at one time to go through this Get Synced process with you. That way, prior to their AEP appointments, you have all of their updated information, and you have that scope of appointment without having to manually do that. Now, it may not be the best for every single one of your clients. I know some of your clients may not be as tech savvy, or you may not feel as comfortable them going through this process. But speaking with a lot of agents, but also seeing how many of our consumers are engaged through this Get Synced, it would blow your mind. As many times as agents say, I don't think my clients can do that. Again, we are seeing thousands and thousands of consumers engaged through this Get Synced. So at least give your clients the opportunity, especially the ones that you may feel comfortable with that. So what Get Synced does, and you can send this to them. I'll show you a couple of different ways that you can send this over to them, but simply just sending them a link to this particular landing page is going to take them to this Get Synced button. So you can just share it out even with your own emails or your own marketing efforts, getting synced with your clients just by sending them directly to this URL. But what Get Synced allows them to do is share their health information with you, or update their health information, as well as allow them to learn about how much life insurance coverage they may need by asking them like a short series of questions, just to get an estimate of how much life insurance you would need based upon your current debt, your income, your mortgage, if you're still paying for any type of education for your children, really providing you that estimate, which is great. But we're going to focus on the health insurance products for now, but they can get synced with you for both. So what this will end up doing for you is that it will either it will either pre-fill their information for them after they fill out this basic kind of information section. So we're going to go through this, and I'm going to show you exactly how it works here. Just getting a couple things loaded here on my end. Okay, so I have a client, and her name is Kate Wilson. So I send Kate Wilson over to my Get Synced page, and Kate lands on this particular page. So Kate's going to go through and she's going to type in her information here. And when she types this information in, this system is going to do a kind of a check to see if this person is a contact record for me in my platform. So I'm going to just, again, finish filling out her information. So Kate goes through this, fills it out. Down here below is your permission to contact. So this is just that legal verbiage that you need for permission to contact, CMS guidelines. When I hit continue, or when Kate hits continue, I should say, what this does is it pings my integrity contacts, and it will say, does this person exist as a contact record for you? So if they do exist, what this will do is it will pre-fill what you have in the system. So let me just show you that example. If I would go into my contact record for Kate Wilson, this is her contact record inside MedicareCENTER. I click on Health Profile. I have her providers, her prescriptions, and her pharmacies in here. So as Kate is going through that Get Synced, all of those same items would end up appearing here. So as Kate goes through this whole process and she makes changes, it will instantly update that contact record for me inside MedicareCENTER. So let's say that she wants to remove one of these pharmacies. She could do that, or she wants to add a new pharmacy, or she just wants to skip or continue on to the next section. She could do that. She would go through and confirm providers. Okay, well, maybe she started seeing another provider and I want to get that provider added. She wants to go ahead and add that provider to her profile. So I can go ahead and select that provider. So then as she goes through, that will then update and add that provider to that contact record that I have. Same with medications. So if she looks at the medications, she's now taking another medication. She can select that medication, the dosage, the quantity, the frequency. She can update that prescription in the platform. The next thing it's going to ask her about is her current coverage. So is she enrolled in a Medicare plan, have coverage through a group employer? And this is really nice, especially if you're working with a brand new client, because if you're working with a brand new client, the system will have their pharmacy, their doctors, and their prescriptions. They'll have it all blank. So you'll be able to then gather all of that information because it will instantly create a new contact for you in the platform if we don't recognize that contact already exists. So again, you're utilizing it to either update what you currently have on file for them or gather that information prior to that appointment for a new client. It's also going to ask, and this is really going to help you determine if they would be a better fit for a Medicare supplement or a Medicare Advantage plan by asking them some additional questions. So how often do you travel? Maybe if there's somebody that lives in more than one location or travels more frequently, they may be better for a Medicare supplement plan than a Medicare Advantage plan where there's those networks. What's more important to you, choice of doctors or keeping a low monthly premium? Again, choice of doctors, Medicare supplement, being able to see, their provider of choice versus having to make sure that those providers are in network for that Medicare Advantage plan, or keeping a low monthly premium. Again, they cannot afford the cost of a monthly Medicare supplement plan. So that's where they can answer those additional questions just to really help you gauge too what the best product for them may be. And then they're going to go through and complete that scope of appointment. So they can select which products they wish to discuss with you. We pre-select I'm enrolling myself. And then by checking this box that they've read and understand the contents of the scope, and then they can go ahead and hit continue. Now, any of those sections, they would be able to skip if they wanted to. But what this will then do is it will prompt them to create a profile at the end. Creating a profile at the end is 100% optional. They do not have to create a profile. Anything that they just did is already updated in that contact record for you. But the benefits of creating a profile would allow your client to sign in on your Plan Enroll website at any time of the year and see what you have stored on file for them, for their health, as well as any plan information that you enrolled them in. So it's a great source where they can go to and kind of sign in to see that without having to then go and get synced with you and go through all those processes. So completely optional. They do have to have a valid email, and we can only have one email per contact. So you can't have a husband and wife have the same login or share the same email address for those. So if I go into that contact profile for Kate Wilson, I'm just going to navigate to this overview section just to kind of show you how you're also notified that the client went through that get synced process. So I'm just going to refresh this page here quickly. So a couple of things you're going to notice in your overview section is you will see those activities. So you'll see here from the 4th, June 4th, that contact information was updated. And it kind of tells you through the Plan Enroll Quick profile, Kate Wilson's information has been updated, meaning that she updated providers, pharmacies, things like that. You're also going to notice that scope of appointment is signed there as well because she completed that particular scope. So you're going to see that in those activity sections. Down here below in your client notes section is where if they indicated that they enrolled in a Medicare plan, that will carry over into your client notes section as well. Now, if your client indicated that they receive a low income subsidy or that they were dual eligible for Medicaid, this is where it would have prompted it to say yes to Medicaid, yes to low income subsidy. So those would end up have been selected if they would have selected that through that process. So the get synced is really talking back to your CRM to make sure everything is updated. That way, when you do go and you run a quote, we will default to show you special needs plans, and then we would automatically apply that low income subsidy to the quote results. In the health profile section, this is where you will notice that that additional provider was added and that prescription was added as well. So all of that you can see updated in real time for us. And then in the connect section here, if I go over to the scope of appointments, you're going to be able to see that signed scope that we just did. So we can see when they signed it, the products they agreed to discuss, and then contact after. We do track with that 48-hour waiting period for those particular items. So again, just through getting synced with them, we were able to get everything that we need prior to that appointment. So great benefits there for taking advantage of that get synced. Now, for those of you that are thinking, not all of my clients are going to be able to go through that process, don't worry. You can always come into their profile when you're meeting with them, and you'll be able to manually walk through and add their providers, add their prescriptions, add their pharmacies. So you'll still be able to manually do this with your client if you prefer to do that. And then for any of your clients that you just want to send them a scope of appointment prior to that appointment, there's a couple of ways that you could do that too. You could, let's say I have an upcoming appointment with Kate Wilson and I need to send her a scope of appointment. All I can do is come down here and send her a new scope, and I can send her a scope by email or by text message. And if I need to track it with the waiting period, I can include that in there. If I don't need to track it with the waiting period, then I can deselect it, and then I can send them that scope of appointment. So you can manually send that scope out. Now, when you send them a scope of appointment out from the platform, is that it will pre-fill all of those products for your client, as well as pre-fill all of that contact information that you may have stored for them in the system. So I'm just going to quickly send over a scope of appointment. That way you can see really what that looks like in the platform. We will tell you if like you're doing a text message or email, if it's a true email or a true text phone that can receive text messaging. So that's, again, beneficial to really have. But what I want to show you on this scope is just how it looks when it's delivered. And keep in mind, you can create a contact record if you would like to, like create yourself as a contact, and you can go through these particular steps. That way you can see those particular screens as well. But it will come from a no reply at planenroll.com. And then you will be able to click on this complete SOA, or your client will click on that complete SOA. And this is where it will take them to your Plan Enroll landing page. Well, they'll see your photo, your contact details, and then you have your scope of appointment form that has those products that are all pre-selected. They can always unselect a product if they need to. But notice all of Kate's information pre-fills for her. And then all she needs to do is, by checking this box, I have read and understand the contents of the scope, and then hit submit. So it's very easy if you just wanted to send that scope out to your clients, and you can do that from their contact record, or you can do that from our Client Connect marketing, which I'm gonna also be covering here today. So I wanted to show you all of that. That way you know how to send those scopes out prior to your appointments. And then you will be able to come in here and complete that scope after that 48-hour waiting period is up, or right away if you did not track it. So I did not track this one that I just sent. So I can come in here and I can complete that scope. It pre-fills. I can see what they agree to discuss, their contact information. method. So maybe this was an inbound call, so that's why I didn't have to track it, or was it walk-in appointment? Date that it was completed. And you can't, you have to do this at the, you can't have scopes done for future dates. You can go back after that appointment. So let's say the appointment was on Monday. I can backdate it. I just cannot forward date that when that was completed. Okay. And then submit, and then it will just save to that profile. So if I ever need to come in here and print it or save it, I can just right click on it. We don't send it to any carriers because we don't know which carrier you just are going to do that enrollment for. But it will then be there as that you'll be able to end up viewing it. So what I really like, and these are kind of some of the advantages that I really want you guys to think about, and as we get ready and prepare for AEP, is that let's say you do end up sending your clients out a bunch of scope of appointments, or you utilize our Client Connect marketing to send a bulk email for scopes. You'll be able to come in here and track those clients that you have sent a scope to that have not yet signed it. You can also track which clients have signed a scope or ones that you have gone through and completed as the agent. So this is just a great way of doing some checks and balances to be like, okay, I did send out a bulk email to 100 of my clients. I want to know which ones went through and signed it without having to go in and manually check. I can quickly filter out and I can see, okay, 50 of those contacts, I have their signed scope. So who do I have to follow up with? So if I click on SOA sent, this would then tell me who are those clients. So 58, who are those 58 clients that I have sent a scope to that have not yet signed it? So great ways of you just to make sure that you have what you need prior to those appointments. All of those scopes are e-signatures. So you'll be, it's all just kind of clicks so that they went through and clicked. There was no like mouse signature. They're just kind of clicking that, I agree, and then submit. The other thing I really want to talk through, again, ways to really take advantage of this system for AEP, and maybe some features that you may not know about. So the contacts platform does a great job of really allowing you to slice and dice your clients or your leads based upon a lot of different kind of key contact tags. Keep in mind, you can also view your contacts on a map. So this is great for a lot of agents who work locally with their clients, and you may be scheduling a lot of appointments. And it would make sense to maybe eliminate all that extra drive time instead of driving clear across town to one client, to another client, to another client. This is maybe a great way to help you plan out your day by really seeing where your clients are located on a map view. I also love this feature on the mobile app because you can just go ahead and click on a contact, and then it will automatically pull up your Apple or your Google Maps and navigate you to their house. So that's really cool feature to have available, is that you can see those on a map. The other thing that I want to point out to you guys with these filter contacts is that you can really filter out your clients based upon what stage you have them in the platform. I highly recommend to take advantage of the reminder section. So within each particular contact record, you can go in and you can set a reminder. So maybe those reminders would be to that maybe you have reminders for your appointments, but then you want to have a reminder, maybe 3 days prior to that appointment to confirm that you have that scope 48 hours prior to that appointment. So maybe it's a reminder for the actual appointment that is coming up, that you have everything that you need. Maybe just reminders on basic client follow-ups, maybe their birthdays. If you do call all of your clients on their birthdays or the week of their birthday, maybe you have a reminder for their birthday to give them a call. If you're doing those enrollments in the platform, we will also tag your clients based upon product and carrier that you did those enrollments in. One of the, probably the one that I'm going to point you guys to the most is your Ask Integrity priority tags. So for those of you that listened and did your enrollments in the platform during AEP, thank you, one, for listening. But secondly, you're going to be able to take advantage of these shopper tags this coming AEP. So shopper tags, how they work is that if you did their enrollment in the platform, so inside MedicareCENTER, you did that enrollment. AEP, we're going to help you with retaining that client. So we will identify your clients on a scale of 1 to 5, 5 being a client that's going to have major coverage changes. So if any of your clients' plans end up getting terminated, we will end up being able to help you quickly see which of your clients had any plan terminations. We're also able to identify, is that plan available in the zip code that you have stored? So maybe they end up moving, you have a new zip code on file, that plan is no longer available to them in their new service area. If you entered in their prescription drugs, their providers, their pharmacy, we're going to help you identify any clients that had changes to those. So is their provider no longer a network? Is their prescription drug no longer covered? Is the cost of that medication, did that increase? So we're able to utilize, and that's why we call it our Ask Integrity. That Ask Integrity is our AI. We're able to utilize AI in the background to, one, look at the plan that you currently enrolled them on, and then two, figure out if that plan is still available and did their coverage change at all. So then come AEP, we can really help you identify those clients that you should be focused on. So we won't then kind of tell you exactly what plan to enroll them in as far as like a better plan. That's still going to be up to you to kind of shop those particular carrier plans and determine that, but at least helping you set the tone for AEP. And that's really where our platform stands out and where we really care about that particular agent, is helping you retain your book of business and saying, okay, I have to reach out to 200 clients, in the next, 2.5. Which clients should I focus on first? We need to focus on the ones that are going to see that retention. Marisa, did you lose me?
How do you know that? Yes, a little bit. Can you hear me?
I can hear you. Can you hear me? Because
We can hear you just fine.
Okay.
We do have some things in the chat, Anna, that maybe we want to address. Just some questions regarding scope. We have a question from Alicia just about clients not recognizing emails from Plan Enroll. I think that's good feedback that maybe in the future there's a way that it can have their name attached to that email, like Alicia sent you a link from Plan Enroll.
Yep. So that's a great point. So my screen just kind of froze on me and my Zoom froze too, which is why I was asking if you could, I was still there. I'm trying to. Can you still hear me?
Hearing you, yes.
Okay.
And I'm happy to read the
My
questions on
computer-
behalf of brokers for you.
My computer is asking me to either wait for the program to respond or close the program. So I'm going to close the program and come right back in if you don't mind.
That's great.
Okay.
And we'll address these questions in the meantime. So for the question about recognizing emails from Plan Enroll, I think that's great feedback. A positive with Medicare Center is that they're always open to feedback, and a lot of these resources that Anna's speaking to right now is because of the feedback that we get from brokers. So the fact that they're going to be bringing a Medicare supplement enrollment to Medicare Center itself, as opposed to having to go to CSG, that is direct from our brokers and their feedback. Yes, we talked about e-signatures. Lori, I am also curious about clients being able to see notes put into their contact form. As far as I understand, that is specifically just for you because Medicare Center does not allow you to upload like Word documents to store in your client's account. So the notes section is just for the brokers to kind of just keep tabs on what's been going on with your clients, what plan they were considering, etc. So I don't think so, but I really want to hear from Anna on that one. More questions about the scope of appointments that she can address. David, yes, I mean, contacts, any of the sales team can definitely help you with loading existing clients. That is an option. There's a way to upload an existing book if it's in a certain format that Medicare Center accepts, but like Excel, some of those obvious ones, it will. We can help you with those. I know we've had other agents who want to understand a little bit more about, I think someone was talking about reaching out to your book of business kind of in a mass base, printing labels, mailings. That's where these tags and these filters come in handy. So I know there are trainings on that. If you get into your Medicare Center account, let me see if I can share my screen really quick while we're waiting for Anna. Oh, Anna's back. Marketing team, if you can allow Anna's audio, please.
All right, I think I'm back.
She is.
Okay, sorry, sometimes that Zoom did not like me there for a second. Yeah,
Never liked me.
let's get through those questions. The first one I know that you addressed was the plan enroll emails. So if you send out any of the emails from our marketing section, so the marketing section, we do have pre-approved email templates that you are able to send out. And when you send out emails from this particular version, this will come from your first name dash last name at Plan Enroll. So this may be a better option for you. So in your in that marketing tab, you can send an email or you can send a text message. And we have a lot of different emails templates that you can choose from. So if I want them to sign a scope of appointment, I can choose from a filtered group of contacts, or I can pick a particular contact. So what's great about this is you can say, I want to send it to all of my contacts that have a certain stage or a certain product tag. So the option there, I'm going to just send it to a contact. If I send this over to Kate Wilson, when Kate ends up seeing that particular email, it will come from her first name dash last name. So that's what I recommend if you want a little bit more customization in the emails that you're sending it, is to go through that marketing tab. Okay, and then what other questions did we need to address in here?
Anna, if you can just speak to, can clients see what notes brokers put in the contact forms?
No, they cannot. So if they end up kind of creating that plan and enroll profile, I'm assuming that's where that question came from. They will not be able to see your notes.
Yeah, integrity is very locked down and very private and compliant. So I didn't think so, but that's a great thing to verify. We've got some questions about the scope of appointment. Do we now have to go back in to complete the scope, or is this optional? That's probably referring to plan enroll, like if the client completes it, then no, you do not. Scopes are never optional, but if a client is completing it through plan enroll, then no, the broker does not need to go back in. What about, I wonder if his question is regarding, you know how the agent has to say complete?
Yeah,
To
you'll
the,
have to go in and like complete it after your client signs that scope. You'll have to go in and complete it.
right, okay,
So like if they went through that client synced, or I sent them a scope, once their scope's done, you'll come in here and you'll complete it as the agent. You need a new scope of appointment every year and for every Medicare Advantage enrollment that you do. But if let's say you already have one signed and then they go through client sync, as long as you have one signed for the current enrollment period, you don't have to have multiple signed, if that makes sense.
that does make sense. Is there a way to, let's see, there's a question here. Does the filter out by date? Is it going to still pull up completed scopes that were in the past?
So come AEP, we will clear all of those out. So if you did the scopes in the platform and they had prior SOA tags, we go in every year prior to AEP and we clear those out for you. So it'll start out fresh.
Okay. And how do we send out mass emails to collect scopes? Is there a way to mass email your contact list?
Yeah. So all you do is you go to this marketing section here at the top.
Okay.
At the very top of that marketing section, there's going to be a button that says new campaign. So you'll click on new campaign. You'll give that campaign a title. And then once you give that campaign a title, I already have one created here, so I'm just going to use this. It's going to say that you want to create an email. So again, you can do an email or a text message. A text message is only going to be one-to-one. So we can do an email and then we can pick the SOA template. We have other templates that you could pick in here, but this is just utilizing the SOA. And you can do it to any contacts that currently don't have an SOA tag. So this would be at the very start of AEP. We clear everybody out, so nobody should have tags. You just want to send it to everybody who doesn't have one. You can send it to a contact. You can send it to a filtered group of contacts. So you can say, I want to send a scope of appointment out to any of my clients that are identified as a client in the platform. You can do it that way. Maybe you have taken advantage of custom filters. So I know like custom tags, we can talk about that here too. But maybe you have self-identified your clients in certain groups through custom tags, and you want to send it to a particular grouping of contacts. You could send it to utilize tags for that too. And then all you would have to do is come in here, preview that campaign, and then at the very bottom, send campaign. And any of those emails that you send out from the platform, you will be able to track the open rates to see which clients opened up those particular emails. So we can come down here and we can see for the emails that I sent, how many were delivered, and then what percent opened that particular email. So this invitation to plan enroll client sync, if I want to see who are those 19 people that opened up that email, I can click on that and it's going to provide me the list of contacts that opened up that email. So then I can do proper follow-ups as well.
Great. And is there a way to, you know, when the agents have to complete the scope, is there a way to already send it that pre-signed so that they don't have to go back in and complete a scope?
Nope, they'll always have to go in and complete their scopes.
I figured for compliance reasons, probably not.
Yeah. Yes, because
Okay, thank you.
you have to know, you have to see which products they agree to discuss with you. So you have to, that, yeah, it's a compliance component of that.
Yeah, definitely. We've got a question from David just about loading an existing
Mhm.
client base, possibly printing out labels, doing mailings, downloading a book of business. I know
Yeah.
that the sales team at Fidelis is well versed in some of these and we can always back up Anna and help our brokers as well. In addition to utilizing, if you can highlight Anna too, just where the Learning Center is.
Mhm.
Because I know you record all of your trainings. We love having you of like live action today. We're so lucky, but there's
Mhm.
so much to cover with this platform.
Yeah.
It's hard to do it in an hour. So
Yeah.
if we can just address David's question about
Yeah.
possibly printing labels, mailing, and then
So one thing that you can do is that if you have your contacts page up, on the far left-hand side, you have this box right next to the name. When you click on that box, you can then export all of your contacts out into an Excel file. So this will provide you an export of all of your contacts and all of their contact information. We do not export any PHI out of the system. So no personal health information gets exported, but you can get an export of all of your contacts and their contact details. If you filtered your contacts out first, so maybe you say, I want to get a filtered list of any of my clients that are on Aetna's plan, and then I want to go ahead and export these clients out, you could do that too. So you can always filter out prior to the export if you were looking for a grouping of contacts. You have an import option at the very top to import your current clients. So these are the fields that you are able to import. Just please make sure that you are following the proper formatting of that. With the import, we do require a phone number and an email for an import. So if your client does not have, or you don't have one of those for your client, you can either just put in a fake email for the time being. Otherwise, what you can do is you can manually add a contact. And when you manually add a contact, you just need one method of communication, either a phone or an email. But the import does require both. And the import does not like duplicate contact details. So just kind of keep that in mind. If you have a husband and wife that share the same email address, you may want to manually add those. And then for training in the Learning Center, so we do have a Learning Center here, the upper right-hand corner in that drop-down menu. We have our training schedule. I'm hoping they updated that this is gonna update. My Chrome just takes a second, but I put that link in the chat earlier. I'll repost it, this events.integrity.com. This will have a list of all of our upcoming trainings, live trainings, upcoming ones that we have. We also have all of them available on demand too. So if you want to come in here inside Medicare Center and you want to see an hour-long training on enrollments, maybe a new to Medicare Center, client retention strategies, we have different webinars that you can watch. We also have our tech tips. So our tech tips are short 15-minute trainings that go over certain features of the platform. This is also a great resource for you as well. What other
thank you,
questions?
Anna. I know we're almost out of time. This is such great information. Can stages, when you're tagging and you're updating in your client profile, will stages change automatically like they have in the past, or do we have to manually change them?
Stages will automatically update for you based upon your engagement in the platform. But if you wanted to manually go in and change a stage, you can. So you can always go in and change somebody from engaged to a client. So you can always do that. Otherwise, the system will recognize the activity for you. In a client profile, those those tags are also here. So if you wanted to create your custom tags, this is where you would do that in a particular contact record. We don't allow you to manually change any of the other tags except custom tags and then your stage. You can always change that stage tag, but like product tags, campaign tags, SOA tags, those are all manually done. Those are all automatically done for you in the platform.
Great. We have one more question, a couple more questions. Oh,
Yep.
will all special needs plans be available for enrollment? That's a great question. Not every carrier works and partners with MedicareCENTER, unfortunately. So I know certain plans just through trial and error are not available. So that's a question, Anna, about will all special needs plans be available for enrollment?
Yeah. So inside MedicareCENTER, just a couple of highlighted or probably best practices here. If a plan is going to be available for an enrollment, we'll show them when your My Appointed Plans is selected. But if a plan is not available for enrollment, in order for you to quote them, you'll want to unselect My Appointed Plans. This will pull up all carrier plans as well as the ones that you're contracted with. But any ones that you cannot do an enrollment for will be when this My Appointed Plans is unselected. So you'll still be able to quote them, but you may not be able to do enrollments for them, and that is all dependent on the carrier and what the carrier is allowing. I'll answer another question I saw in here, Alicia. We are adding a calendar appointment booking. We are adding that for this coming AEP. So it's going to work very similar to Calendarly, where your clients will be able to see your availability and book time with you. So that is a feature that we're rolling out. We're also going to be rolling out features where you can track your production in here, track your contracting, track your commissions. So we're going to be rolling out what we call integrity for agencies. And it will also allow you capabilities to kind of manage this at an agency level and see any of your downline agents kind of production and get your other agents contracted, commissions and things like that. So that's also going to be available to you guys starting sometime this summer before AEP.
Right. I know we're out of time. What about last question from Paul. Can you add information about a client's Medicare Advantage plan if you weren't able to use the platform to enroll a client initially? Can you go back and add information about their plan?
So our policy section here is all auto-generated from the plans that we get from there. If you are contracted with that carrier, and you did that enrollment and you're contracted through it, kind of our integrity hierarchy through Fidelis, you may see those policies in your policy snapshot. You may see those in your unlinked section because we do pull policy data from carriers. So even if you didn't do the enrollment, we may still have that enrollment in there. We do this with most of the major carriers. But if you don't see it as an unlinked policy, you could document it through custom tags. You can add it as a custom activity. You can add it to your client notes section if you just want to document that information. But I would check maybe your unlinked section too. You may have some policies in there that you can link to contact records.
Amazing. Thank you so much, Anna. I know we're over time, so thanks for being
Okay.
so.
No, I don't have anything after this, so this is completely fine.
Well, a lot of people are still staying on. So there's clearly a need to just kind of want to know, which I love because we're always encouraging. I mean, it feels like we're in a lull season right now, but we're really not. There's so much opportunity, and this is the time that we always encourage our brokers to get on here. I love what you said about to start filling out, you can start sending can start sending the clients the plan enroll to have them start updating things. So let's just do that now. Watch some training videos that are very specific. I love being able to cherry pick which feature I need to learn more about because, I have certain things down, but I always need to have a refresh on other topics. So you can do that through the Learning Center. I guess we could use the remaining minutes just to look at any more specific questions for our broker since this is for you guys.
Mm-hmm.
Are you able to see the chat?
Yeah, I can see it from anything
Okay.
that I signed in the second time, but nothing prior to when I had to exit.
No problem.
Um,
I think we got everything prior to. Looks good.
I'm trying to think if there's anything we didn't cover here. Um, I will say the more enrollments that you can do in this platform, the better. Because once you do an enrollment, we will show a PDF of that enrollment here in your activities section. So you'll always be able to see that PDF enrollment as well as be able to see those in your policy section. So that's also a great benefit of just always being able to have that information at your fingertips. We try to get as much information as we can from carriers, but the more you do in the platform, the more we're going to be able to show you in the platform and not have to rely so heavily on carriers feeding us that particular data.
Awesome. And Anna, will you go back and just really quickly show us how to find that? Where do we go if we want to reach out to everybody? I know you went to your contact list.
If you want to send a marketing email out from the platform,
Yeah.
yep. So just go to this marketing section here at the top. And then all you need to do is create a new campaign. So you'll hit this create new campaign. You'll give that campaign a name. So let's just say reach out, create. And then it's just going to ask you what you want to send. Do you want to send an email or a text message? And then what message do you want to send? So if you want to have your clients call or text you, you can then send it to all contacts or a filtered group of contacts or a contact. And then you can see what that preview message looks like.
Perfect. Thank you so much. And I can follow up with that broker. Yes, there's a question about using MedicareCENTER as a CRM. Absolutely. At a minimum, it is a very locked down. The sales team here at Fidelis, we do not have access to your information. I don't know your password. When you say I forgot it, we don't know because it's so confidential and so private. So yes, and everything is stored up for 10 years. I mean, it was, and I think it's still the same.
For all, yep, for your scopes, all your scopes, your call recordings. I know we didn't even touch upon call recordings today, but yep, all of that will automatically save for you. You can store any contacts you want in here, so they don't have to be Medicare contacts. This is where you're going to see more products being added to. So the question about ACA clients, absolutely. And what you can then do is you can create a custom tag and tag your ACA clients in here. So that way, when you need to go in and follow up with ACA clients, you could just utilize custom tags that way. And really you can do unlimited custom tags. So you can tag all your ACA clients with certain carriers if you wanted to, through those options.
Perfect. Thank you. And no, we didn't have a chance to touch on call recording, but I think every broker out there knows knows about call recording, when to use it, when you don't need to use it. Medicare subs, remember, are completely separate. They do not follow the same guidelines as MAPDs and prescription drug plans from CMS. So when it comes to scope of appointments and call recording, we're not even talking about supplements there. This is for your MAPDs and your PDPs. Again, the sales team, we're versed in this. You can do your self-paced learning through the Learning Center. They have very specific trainings and webinars just on each and every feature in Medicare Center. So we would encourage that. And again, using this downtime before things get real exciting around here. It's already certification time.
Yes.
Anything else that we forgot? I'm looking, everyone's saying thank you. This is great. When can we do it again?
Yeah.
I know. I would do a training with Anna every week if I could.
And you guys honestly come in. We have trainings coming up this month. So I know we have one this afternoon. I know it's in 50 minutes, but we have one this afternoon. If you even just register for any of our upcoming trainings, you'll automatically receive the recording. So it's what I like about this is that I know it works for my schedule, does not work for everyone's schedule. So you can register for any of our trainings that we do, and you will receive the recorded version and you can watch it. So we have one coming up next Monday on a lot of what we covered today. So it's kind of going to be like a recap of working with a client start to finish and like new to MedicareCENTER. We have one just on Medicare Advantage, quoting and comparisons, sending communications out through Client Connect marketing. So all of these trainings are an hour long on certain features that you can dive deeper into or watch them on demand. So we already have some on here on demand as well.
That's great. And Anna, if you don't mind, I know your team works really hard and they're still posting all the trainings for June. But when you get that, if you could just shoot that over to the Fidelis sales team so we can get that out to everybody.
Yep, it is on. Oh my goodness, this other phone's ringing. I'm sorry about that. Hold on, get that.
Yeah,
So yeah, it's there. The schedule's already on here. So
it
if you
is. Okay.
so if you go to events.integrity.com, this is our live training schedule right here. So we don't have
Great.
to worry about that PDF being updated, just
Ah,
events.integrity.com. And then just make sure that you click on this view more. And this
perfect.
has that whole list.
See, I'm behind the times. MedicareCENTER just moves so fast with all their technology. I'm still archaic over here.
Yeah, I know we previously had that PDF in there, but yeah, everything we have it posted here. That way, all of the upcoming trainings and all of the ones on demand are on one page for everybody.
Yeah. Alicia, if someone's client status isn't changing automatically, and you're just not wanting to keep doing it manually, I would submit that as a ticket because that might be something specific to that client.
Yeah, and it could be too. So making that particular individual a client is dependent on us getting verification back from the carrier that that policy is active. So it could be that that particular carrier we have not received updated data for. So that could be why you may see like a pending policy in there and it's based on the effective date, it's active. It's just because, again, we rely so heavily on carriers to get us updated files and information. So it's probably just because of that particular case.
Great. Thank you so much. Really appreciate everyone staying on. This is such valuable content. So we will give you back your days, plural. And yes, reach out to your sales director if you want to set up a little like mini training because
Yeah,
there's so much to learn.
yeah. I just saw Douglas, your question. If you go into that contact record underneath your tags, assign a new tag. This is where you can create your tags. So just go into any contact record to do that. So, okay, that was the last one.
Awesome. Thank you again. Thank you for joining everybody.
Have a great day.